Audio Jungle. Audio Jungle. Audio Jungle. Audio Jungle.
Welcome everyone for coming to our AGM today. Last year marked a very significant milestone in the journey of MRC. I know mentioned some of the challenges that we have faced as a community, but also how that would impact the work that we are doing to support our families who maybe needs our help. But also at the same time, there is a lot of indications about resiliency and strengths of MRC. I'm just going to highlight maybe a few of these strengths that make MRC unique in the work that we are trying to do in our community. I think the first point I would like to mention here, the uniqueness of the work that we are doing is prevention and early intervention. So with prevention, unfortunately, we don't see a lot of numbers, but there is really significant long-term impact. So with prevention, with early intervention, we de-escalate conflicts that could maybe lead to tragedies in the families or in the community. So also the early intervention means that we identify risk factors as early as possible so that we can intervene in the early stage. When you intervene in the early stage, you have enough room to negotiate. So you don't have, of course, in this way, to involve authorities like the police, children's society, and the court. Not because it's not necessary. The justice system response is important, but then not necessarily to be involved in any case or any situation. So that's really what MRC does. In doing so, we save lives, but also we save money. Imagine if you are in crisis, how much money you will pay for the lawyers, for the mental health counselors, for the court system. So we save money for the people who are really struggling, but also save money for the government. I know, for example, just from the work that we have been doing with the Children's Society, we know there is also positive impact, not just because we keep children safe and keep their connection with their families, but also we save money. I know that each child will be admitted to a care of the Children's Society will cost $40,000 a year. So just really make simple calculation and we see how much money we save. But most importantly, really to elevate a lot of pressure from the family. Whenever, for example, CS would call you, will bring a lot of anxiety in the family. But we work with the family, work with the children, and also work with CSS. So I think the second point that I would like to highlight here is collaboration and coordination. So basically, everybody who knows MRC, we're really good in bringing people together. Sometimes I joke and say, we bring potential enemies to work together towards a common cause. Because sometimes it's difficult to bring a religious leader to work, for example, with women advocate, or to bring, for example, CAS to work with community organization. We have been able to create safe space for all these people to come together and to work, to support those who are really the most vulnerable. And I would like to say here clearly, especially women and children. We work to support women and children, but also at the same time, we don't want to alienate the family and the community. And that is really the uniqueness of the work that we are doing, and we call it culturally integrated family safety response. We try really to walk the fine line, make sure everybody is safe, but also at the same time, look at the strengths and the assets that the community have. That's why, for example, MRC really consider as a bridge, as a safe place for everyone to make sure that everybody is safe. But most importantly, as we said, really, working with people where they are at as early as possible so that we can prevent escalation that could lead to tragedies.
The MRC model is being looked at across the country from Vancouver in BC to Halifax, Nova Scotia. The government is listening. People are understanding that grassroots, community-based organizations taking care of its own community in collaboration with the government is the way to address all these things. These models are creating MRCs across the country.
So we provided services to 160 clients. These are direct services that you would consider as one-on-one counseling, one-on-one support. This kind of work is undertaken by social workers or social support workers or outreach workers that we have at the agency. And then, we follow these cases and then we refer them on to whatever appropriate services in the community, other community services that they may need. Some of these cases stay with us because we're the ones providing the primary and direct care. Others are referred out to more specialized services. Social support and access to basic needs have really become key over the past year and the previous year, especially because of the COVID pandemic. And so 44 out of 160 requests that we've received have been for basic needs support. And that's not something we technically do. We obviously pair clients up with services in the community that provide these basic needs, but that is a need that obviously is becoming more and more evident with the pandemic being prolonged. We've been engaged with 33 families that present struggles with access to services for differently abled children. I'll talk about some of the programs that we've developed specifically for them. This is a very, very isolated group, especially within the Muslim community. They feel isolated, and they are isolated simply because there isn't much programming in the way of programs, community programs, for example, for them. And so one of the things that we attempted to do here is to, first of all, provide access to these families to essential supports that they need to look after their differently abled children, but also, just as importantly, to link them up with communities and community organizations where they have a social environment that they can belong to. We are dealing with a lot of newcomer families, and a lot of them are living in substandard housing with a high rate of poverty. We're estimating about 55% of our clients who are newcomers are in that situation. And so we facilitate the initial contact and referral to community-based organizations to help them. Helping Arabic newcomer families with different abilities to be empowered is a long name. We just have a kind of a nice acronym for it, HAND2E. This is the second phase of this support for families of differently abled children that I talked about. The first phase was during the COVID pandemic. We felt that these families were even more isolated during the COVID pandemic, so we got some emergency funding through the London community organizations. And then we had some funding to carry over after that ended by the mosque for about 6 months, by the London Muslim Mosque. And then we are currently, we have a grant from the Ontario Children Foundation to continue this work. This is going to be a permanent feature that we have at the agency. Newcomer support programs, we just started the first, we did 1 year of a 5-year grant with the Ministry of Children and Community and Social Services. This is more of a newcomer settlement program. We don't do settlement per se, but we do realize, and the government does too, that a lot of these families need additional supports than just what you would term settlement, not just schools and shopping and groceries and doctors. We're talking about emotional needs, psychosocial support, etc. June 6th also put a fair burden on the community, and we tried to respond the best way we could. We have a couple of programs that are supported by, one is supported by the London Community Foundation. This is the Stronger Together project, and it's got a lot of different activities in it. We also, some of our staff was also involved in the mural project on Hyde Park Road. We have hired a social worker who works part-time, specifically for cases that are suffering from hate, discrimination, or Islamophobia-related crime or violence, and then they're referred on to psychotherapy consultants that we have engaged. We currently have 65 cases where CS is involved, and we presently maintain involvement in 29 child welfare issues. Some of our major programs and projects that are on social media: It's On Us, workshops for young women and community. We have a gender-based violence peer program with newcomer women. We have psychosocial and educational support groups for women experiencing gender-based violence, healthy relationships groups. Young Men Leading Change is another group. I see Ilyas there, and I know that he was one of the members there, and Wada is here as well, who used to work for us. Strong is a program that we've been working with the university with the school mental health program at Western, and Strong is one of those programs that we lead. What can I say about public education in terms of numbers? Through those various workshops and group sessions, we've had over 360 to about 370 group participants unique participants over the last year, the last fiscal year, over 14 different workshops, and over 176 group sessions. So we're doing a lot of work in this area. Social media campaign numbers, over 268 posts. These are, I guess, important numbers. 1493 reshares and retweets, and 164,000 impressions. Yeah, I'm not really sure what that means, but. So this is just a quote from one of our one of the members, participants from the group. I've come to know that in London, Ontario, Islamophobia is real and it hurts. I believe everyone deserves to feel safe and loved and want to make an effort to ensure that happens. Having a conversation might not seem like a lot, but it's the spark to much more. And that's the basis for a lot of our public education community programming.
The Muslim Resource Center for Social Support and Integration, I've had probably a 7 or an 8-year love affair with. I first attended one of your dinners several years ago, and since then, like many of you, I've been hooked. I've known MRC in various capacities, but most recently, I've been supporting the strategic planning process, and before that, had worked with them on several significant grants that were approved, and those projects are now ongoing. When I was approached to do this project, it was a little bit daunting because I knew what many of the strengths and opportunities and challenges for MRC were already. But we needed to go through a process, and that process, I think, has been instrumental in galvanizing the trust and support of everyone involved, the external and the external stakeholders for MRCSSI. The project is a 5-year strategic planning project from 2023 to 2028. And as Mo indicated, we have been working on that since around March. It has been a very stakeholder-intensive project, meaning that we've met with the board several times. We have met with each program area. We have provided feedback to them. We have met with external stakeholders, community organizations, as well as the Muslim-led organizations, to name a few. You're all more familiar with them than perhaps I even am. The ownership and the commitment, I think, for everyone involved in the process has been astounding. And the strengths of MRC, I think we're all very familiar with that. The knowledge of the community, the unique models that Mohammed has been speaking to. But one of the things that we're looking at is not only where is MRC now, but where does MRC really want to be? How do we take that vision and operationalize that vision? Because there have been strategic plans done before, okay? But the part of this where we can make the vision real by looking at things like the balanced scorecard, right? We can talk about client services, and we know MRC is amazing when it comes to that. But we keep hearing about the organizational capacity, we keep hearing about operational processes and financial management. So we're here to help MRC set a course where we're able to balance out those various aspects of the business. And it is a business, because without the money, MRC can't do anything. So we also have to look at that aspect of it. In terms of the safety that we've been talking about, I think the safety is not only for the clients that are served, it's also safety for the employees. You know, it's knowing that they have employment for the future, that it's not precarious, that funding is there, that it's sustainable funding, that they have the capacity to address Islamophobia with external organizations to be able to do their own, whether it's a social enterprise or however they may choose to do that. But definitely enhancing the organizational capacity is key. Building capacity within mainstream organizations, again, we've been hearing that a lot. And I would like to see the word mainstream done away with. Because when an organization such as MRCSSI is doing the work more and more with less and less, it's no longer a marginalized thing on the side. It is mainstream. And so the funding should be sustainable. The funding should be seen as part of what is necessary for mandated services and getting also transfer payments. So at the end of all of this, I mean, there's just so much I could have gone into, but with 5 minutes, I've just tried to give you a very, very high level. There should be no financial deficit for MRC, that's what we're looking at, because there's been no deficit of clients. We know that each year you're serving more and more, and the numbers tell us nothing. The numbers of cases really don't say very much, because these cases are becoming more and more complex. It requires greater and greater skills from your staff, and the price that your staff is paying is greater in terms of their own personal lives, okay, etc. So because there are no deficit of clients, I see a future for MRC that is stronger, based on a strategic plan that will help them to move beyond where they are, and we're going to be working on the implementation of that, where we're going to be looking at various metrics and how to support the various programs so that they're all working cohesively and in an integrated fashion.
I'm very delighted to announce today that we are launching a new initiative at the Muslim Resource Center called the Center for Culturally Integrative Responses. And this is really an initiative that the board and the executive of the MRC has been talking about for some time now. And the whole idea is to share the lessons learned from the work that we have been doing at MRC beyond the Muslim community. So as you maybe have noticed, the Muslim Resource Center is working with the community on different levels, providing direct services for clients who needs support and help, but also engaging the community to raise awareness, especially in the area of family violence. So the work that we have been doing is not limited with the Muslim community. For many years, research has been one of the key elements of the work that we have been doing. And our research has informed our practice. And when I say that specifically, I'm talking about what exactly MRC does differently from other mainstream service providers or maybe other culturally or faith-based organizations. And that is really the culturally integrative approach that we use. What does that mean? That means actually traditionally mainstream service providers would develop their own strategies to work with diverse cultural communities, newcomer and immigrant communities. But most of these strategies has been coming from one place, really going to your community to educate them. So the culturally integrative framework actually, as you see here, means to create space for culturally based organization to be part of the solution. So to be part of the intervention from the planning to the end. So it's not just really waiting until something happens in any community and then we go to that community and ask for people who help us to communicate or maybe to translate. That is important, but really we're talking about equity. We want really to make sure that communities have a say also in the process of the intervention. Of course, we are not really mandated, for example, in the area of child protection, but we need to have some kind of say when, for example, CS make a decision to remove children from home. So that doesn't mean in any way to compromise the safety of children, but that also really means to hold CAS or any mandated services accountable when they work with families who are new to this country. So that's really basically what we are trying to share, not just really with our community here, beyond London, provincially, nationally, internationally. So the model that we're talking about is, as you see it here, the Culture Integrative Framework. Basically, at the center of this model is the safety and well-being of individuals and families. At the same time, as you see, for example, the first circle is MRC, meaning MRC is staying in the middle between the families who maybe would be involved with any situation and in our case, the Muslim community. And more importantly, MRC also then working with the family, for individuals, with other services, especially mandated services and non-mandated services. So we're not intervening to maybe undermine the process of any mandated service like Children's Society or the police, but we need really to make sure that the families also have voices. It's a very fine line to walk on. I think by now we can say we have evidence, we have enough proof from our practice that this is really working very well. We want to challenge service providers to slow down the process, not to rush, to be more intrusive in their intervention, but also at the same time, we want to challenge our community, especially in the area of family violence. When people, for example, think that's not existing, we say no. And also we want to challenge faith leaders if they're really going to mislead people who come to them with information that put women at risk. So basically, we want to challenge everyone when it comes to harm doing for anyone. So that's the Culture Integrative Family Safety Framework. We have been working so far with about maybe over 20 mainstream service providers. We work with, I think, 6 cities: Windsor, Waterloo, Kitchener, Ottawa, Elias? Niagara. So anyway, with 6 different organizations, what we do here with this project, we build capacity with different culturally based organizations. One of them is here, Hassan Awad from ISWA, Islamic Social Welfare Service or Association. We build capacity, we help them to work with CAS and other organizations. But also we work with mainstream service providers to be more flexible, to accommodate their services to meet the needs of different cultural groups. So that's really what we're trying to do with these organizations. We also work with New Brunswick for the last 3 years. We're working also nationally and internationally to make sure that service providers and cultural communities can work together and create space for each other and to support each other to do the work that they're doing. So this work is really new. We have been working for the last 2 years. Today is really an official launch. I would like really to thank a few people here who have been key in this work from the beginning. Abir Al-Jamal, our research manager. Abir has been from the beginning, and before even this work started, she has been involved in different projects, including domestic homicide 5-year or 6-year project with the University of Western. So thank you, Abir, for all your work. Elias Farouki. Eugene Tremblay also joined us recently because of his experience working in the child welfare system. Where is Eugene? Yeah. Joman, our research assistant. So we're a small team. I also really want to just a few minutes, and then I will stop. This is really very important. I think I want to also, thank the board of directors. I think we have been talking about this for the last 5 years. But 3 years ago, actually, they make a decision to hire Zan as a managing director to support the work that I'm doing, because it is really very difficult to do day-to-day work and manage an organization that's growing, but also at the same time have space to think and to maybe come up with visions to improve the practice of MRC, but also take that to other communities. So I really thank the board for taking the risk and doing this, making this decision. I also thank Zan Salimi. Zan really has been very, very supportive. So Zan and I have been involved with this many, many years ago. I think even before MRC started, the Muslim family, I think maybe almost 20 years. Zina Abu Khader was with us from the beginning. So this really had a history. So I also really want to thank many organizations that really also make this happening. We have a strong partnership with CREBAC, Center for Research on Violence Against Women and Children, ANOVA. Jesse and I have been talking, and we started a conversation. We started with two meetings. We agreed that within this year, we want really actually to continue this conversation. Basically, we want to really make sure, we want really actually to, have this model, the cultural integrative model, to be part of the mainstream family violence responses when it comes to immigrant and newcomer communities. So that is why, for example, we needed this center. Who else? Sorry, because I always forget many important people. So also, of course, CAS, especially Chris Stevens, my friend. We have been really doing a lot of work. We are working now with 5 CASs, and Chris actually helped us connect with all these CASs. I remember I was talking with one of them. I don't want to mention the name. For maybe 3 months, no response. But then I talked with Chris, he called him, and the next day I got the call from this person. So that's really where personal relationship also play a key role. I really think this model is very promising. It's not just really to help families, but also to help service providers, but also to help communities. I talk with other communities in many other cities. If you want to work with CS and you want to really be part of the solution, you need also to build capacity within your team. You cannot just say, you know what, they take our kids, we don't have a say, we are, like a victim kind of, mentality, but really we need to also test or maybe really see what you have and what you need to do. There is a lot of work that we need to do as a community to be able to do things differently. We're very, very happy to start this initiative. Hopefully maybe next year or the year after we'll hear good things. I also want to thank Dr. Katrina Scott. We had last year an amazing program called Community of Practice, where we had involved maybe 7 different organizations to actually examine the cultural integrative model and its implication in their service area. Thank you very much for your attention.
The people who are coming, who are seeking service or who are identified by services, who are immigrants and refugees and newcomers, are facing some unique risks and are experiencing some unique risks for domestic violence and gender-based violence in their families. One example I will give is experience of pre-migration trauma and post-migration trauma and the trauma of the journey and how that plays out and has ripples throughout the family. But I think also equally as important is remembering that the experience of families that you might be serving as a mainstream agency, those families are dealing with very significant, real and unique stressors that need to be understood and considered and recognized. Islamophobia, racism, crazy stresses to do with isolation, to do with poverty, to do with housing, to do with dealing with the Canadian immigration system. And then in working and creating space, we have to have that understanding. The second lesson, or one of the second main things to come out of that project is just how supportive the London community and all of the agencies are of the space and the model that MRC has created. One of the resounding pieces of feedback as we worked through different cases, as we've talked through different situations, was how much support there was from all different sectors and people talking through situations about how valuable it was to be able to connect with and through an agency and a service that could be that bridge between a culture and a mainstream agency, and how much better that was for everybody and for everybody's health and safety. I think that the work that MRC does and will continue to do in its both forms is both inspiring and innovative, and it's really my pleasure to be able to be here and just say hurrah for all of the work that you do. Thank you.